Hello, thank you for taking a few minutes to view this short presentation regarding preceptor training. I want to start off with a big thank you to all of you for coaching and mentoring the next generation of pre-hospital providers. You're the lifeblood of our EMT and paramedic programs. Thank you so much for what you do. As a preceptor, you're charged with an important responsibility. The skills, knowledge, and behaviors emphasized in the didactic setting are fully formed under the guidance of expert preceptors and mentors like you. There are three components to this short preceptor training. One, viewing this short presentation, reviewing the preceptor handbook, and completing the short quiz. The purpose of a preceptorship is to provide students with the opportunity to apply and demonstrate the core knowledge, clinical processes, critical thinking, and psychomotor skills they have practiced in the classroom and laboratory setting. Each semester presents a new set of core curriculum in a logical progression throughout the program. Hence, each semester will have its own objectives and goals for the field experience setting. During Semester 1 field experience, students will observe ambulance operations and paramedic performance. This is a proven learning strategy in which they can focus on behaviors that the preceptor models before having to perform them themselves. Semester 2 field experience can be started after 76 hours in the hospital after the first semester. Students are permitted to team lead BLS calls and perform ALS skills they have been trained and verified to do in the laboratory and classroom setting, such as administering medications, start IVs, perform airway management, and electrical therapy. During third semester ALS field shifts, students must develop their role as a team leader. The preceptor will judge when it is appropriate for the student to lead the call. Credit for team leadership should only be recorded if the student is able to navigate the call with only minimal prompting from the preceptor. The last phase of their field experience is a field internship capstone. During this time, students should be able to team lead 90% of calls with minimal prompting. Students must successfully lead 20 calls, and 15 of those calls have to be ALS level calls. The student should not get credit for a successful team lead if they need too much prompting to have a successful patient call or outcome. Now some helpful definitions. What is a team member versus a team lead, and what is an ALS call or run? As a team member, the student conducts the assessment and management of pre-hospital patients in the team member role with the assistance of the preceptor. In team leader role, the student performs the duties of team leader, which includes but is not limited to managing the scene, performing patient assessments, directing medical care, and making the correct transport decision. To be considered a successful team lead, the student must perform the duties of team leader with minimal to no assistance from the preceptor. So what is an ALS call or run? In an ALS call or run, the student performs an advanced level assessment, creates a differential diagnosis, plans care, performs interventions, and reassesses the patient to evaluate pre-hospital outcome. The ALS run or call should not be viewed as simply completing ALS level interventions or skills. The ALS run or call should be considered as an advanced level patient care process. However, if an ALS call or run is to be identified on interventions alone, it should include 2 or more advanced level interventions or skills. This should only be applicable during the most critical calls when the preceptor takes a collaborative team leader approach due to the severity of the patient's condition. Please reach out to the clinical coordinator or division chief of Education with any questions. And now the important contact information. Please reach out to Battalion Chief Tuttle or myself with any questions or issues. Please do not contact my call with field experience issues unless you cannot get a hold of Battalion Chief Tuttle or Division Chief Dean Mennick. Mike has a different role as a primary instructor. Now on to some student evaluation tools. There's basically two parts that preceptors are responsible for. One is the affective shift evaluation form and the appropriate semester evaluation form. The affective evaluation is used to evaluate how well students are demonstrating clinical, leadership, and professional behaviors. You will actually fill this out, sign, and give back to the student. Here is an example of an affective evaluation that preceptors need to complete each shift. Students must submit them to the clinical coordinator to receive credit for their shift. You'll see it's just a standard Likert scale, and there's a place for preceptor signature at the bottom. On to the second part of semester evaluations. Since each semester has its own set of core paramedic curriculum, each semester will have its own slightly different form to be completed by the student and the preceptor. As an example, you'll see semester 1 is a pretty simple form. It's just one page. You'll see that to the left. There's a place for the preceptor signature, and then on the right is semester 2 and 3, ELS, team leadership, practical and field internship capstone form. In each arrow, you'll notice that there's a place for the preceptor to provide a score based on the standard Likert scale that's up at the top right. On the back page, there's a place for the preceptor just to verify the information and then to sign their preceptor signature. The student will submit this for their clinical credit. So what's next? Please review the preceptor handbook. Some of the answers to the quiz are in the handbook and have not been discussed in this short presentation, and then complete the short quiz. Again, thank you for all that you do.